All right, so we're recording. So welcome to September's Lunch and Learn. While we wait for a few folks, I want to give everyone just a quick update. For everyone who's a current Connect user, the memorandum of understanding that your gatekeeper signed is good for a year, so we're starting to have some come due. So for your agency, if you could remind your gatekeeper to check on that, and I'll try to be in touch with everyone as best I can. And then if you are in the system and you can't send a referral to some agency you know is in there, it's probably because their MOU has not been signed. So feel free to let me know if you're running into any of that, and I'll get the other agency's gatekeeper to get that signed. And we will be streamlining this process going forward. So to kick us off, Ben, can I have you open up and talk a little about what's happening with behavioral health at PureView?
Yep, sure. Hi, I'm Ben McGaugh with PureView Health Center. We have a few different locations. Our main location is right here on 9th Avenue in Helena, and we have our main campus here. In addition, we have a clinic in Parker Medical Center in Lincoln, Montana, 60 miles northwest of us over the pass, and we provide a little bit of different services there, medical as well as behavioral health services. In addition, we opened up our East Helena School-Based Health Center in East Helena. That was, I guess, a little over a year and a half ago now. It was May of 2019. So we are getting our feet back underneath us with the schools shut down and with that clinic being transitioned from just a COVID clinic to normal operations. That's been one thing that we've been struggling with. And then with God's love, we've actually had services there, healthcare for the homeless in that downtown location in Helena. And with the COVID-19, it kind of mixed up some things, and we are starting services back in that location for our case management as of October the 5th. We are still kind of gauging as far as the healthcare as well as the behavioral health services will work in that location, but I've been in close contact and conversation with Ann and Dave at that location too. So that's going to be an ongoing, I have a feeling, an ongoing transition moving forward. But as far as our behavioral health services, I don't know if you know much about PureView Health Center. We provide medical, dental, behavioral health, as well as case management services. We also have an on-site pharmacy at our main location that we do pharmaceutical deliveries within a certain mile radius. I think it's about 25-mile radius. And then we deliver pharmaceuticals at each of our locations as well. With our behavioral health team, we have a licensed clinical social worker. We have 2 of those. One is Trish Leisure. She is a well-knowledged LCSW that's been around for a while, and she sees anyone from the age of 25 down to the little kids. So if there's any kids that needs to be seen, she sees those. And 18 to 25 is the new age range that she started seeing about a year and a half ago. In addition, we have a licensed clinical social worker, Sharon Speck. She sees individuals from 18 plus, and the only thing that she does not see is family members. That is one caveat to her practice. So if you have multiple family members, we will try to accommodate them, and we actually have a social worker licensed candidate, which is seeking her licensed candidacy. And she is seeing patients on site too, and that's patients between the ages of 10 and up. So that's a new person that we have here on site that's working full time with us. We also have a licensed addiction counselor that's here full time Monday through Friday, and she sees individuals from 10 plus. And we also have a certified peer support specialist. This was a new position that we added back in January of last year. This position works with a variety of individuals that come in through our behavioral health group, And it might be someone that may have a mental illness or even addictions. That's the main thing she works with addictions, but she also works on the mental health side as well, and ties with our MAP program. We have a pretty robust medication-assisted treatment program here at PureView Health Center and a contract with the detention center for the peer support specialist too, to help with the bridging of the gap between the detention center and those that are released in the community too, to maintain their appointments and follow through with care. We also have a psychiatric nurse practitioner that provides psychiatric meds and medication assistance there. So that's pretty much our team, besides our case management team that provides a wealth of coverage from one extreme to the other. So any questions? No, that was a lot. I was trying to keep it under the 3 minutes, but I think it may have gone over.
That's great. It's just a list guidelines. Thanks so much, Ben.
Yeah.
Actually, I did have a question, and perhaps you did cover this. I was under the impression previously, but that was a long time ago, that you had to be an established patient of PureView, like on the medical side, like you had to have Dr. McCreary or somebody as your doctor in order to utilize the behavioral health component.
So in the past,
or no?
That's a good question. In the past, we have maintained that policy here at PureView because we want it to be an integrated behavioral health where we have that collaborative care and wraparound services for each one of our patients. But during the COVID-19, once we got hit with that, we felt like it was a need to open our doors up a little bit more and allow for patients to be self-referred, and then also to provide additional assistance in that manner. I will tell you, we do stress to the patients that do self-refer to establish care with a medical provider to get that wraparound services, because we want to treat the holistic approach of a patient. We don't want somebody just to come in and just have 1 or 2 appointments and then go out and they've got some other things that are going on in their lives that may need assistance. So we go for that holistic approach.
Okay, thank you for answering.
Yeah, for sure.
So just so you'll know, in Connect, so PureView Behavioral Health is listed separately as their, you can refer directly to them. And then we also have PureView Medical, Dental, the assistance with enrolling in health insurance is also listed separately, and anyone can access services with Stephen there.
Yeah, Steve Coca is our point person for that, for insurance and outreach. He does a great job of that. He's actually going through another training next week with Medicare, preparing for the open enrollment that's coming up in the upcoming weeks. So, and anybody that needs some assistance with that, feel free to reach out too.
Thank you, Ben. Any other questions about behavioral health at PureView for Ben? All right, great. I will next turn it over to our representatives from Charlie Health.
Hi, everybody. My name is Laura Sebulsky. I'm the Director of Admissions and Clinical Outreach. I also have my colleague, Dr. Caroline Fenkel, on the line with us. She's our Chief Clinical Officer. I wanted her to join just in case there's any deep clinical questions that you guys want to hear in this short little window. So as you all know, suicide is the #1 cause of preventable death here in Montana, which is our why and why we're here. And it's a treatable thing. 86% of people who go through treatment experience an increase in happiness. So that's why we really wanted to launch here. We saw a serious gap in the continuum of care in Montana, and we are a virtual IOP, the first and only here in Montana. So basically we treat kids and young adults ages 12 to 27 who have and need a higher acuity of care, either substance abuse, mental health, or co-occurring condition. And we do that through group therapy, 9 hours of group therapy per week. It's done after school, after work. in a very curated group setting. So like age, like sex, like diagnoses. And within our programming, we focus on both traditional evidence-based therapy, CBT, DBT, MDR, and then also experiential therapies like mindfulness, yoga, guided imagery, really to just connect mind, body, and soul with the kid or young adult. And another part of that is including individual sessions and family sessions as well. We really want to treat the environment from which they're coming, from where the trauma is, so we can just try to work on that healing, that total body healing. We are in network with a lot of insurances, including Healthy Montana Kids. We have rolling admissions. So basically within 24 hours of you reaching out to me, I do the admissions. We do a verification of benefits and can get a kiddo in within 24 hours. And really the purpose of an IOP is we want to prevent them from going into residential or acute treatment, or as a step down. So think of us as like the physical therapists in that gap. You know, if they're coming, oh, go ahead, Caroline.
Sorry, somebody just wrote IOP question marks. I don't think that they know what IOP means.
Got it. Jump in.
Yeah, so intensive outpatient programming, IOP, it stands for intensive outpatient programming. What it is it's a level of care between outpatient therapy, such as once a week to twice a week outpatient therapy, and inpatient residential treatment. The idea is that if you're a therapist and you are seeing a client once a week and you're finding that they're more and more unstable, but you also know that sending them to the emergency room, they're not going to meet the criteria that they need to meet in order to go to a psychiatric unit. They're not going to sit there in the ER and say that they want to kill themselves and that they have a plan. So then the question is, what do you do with that kid? You send them to Charlie Health, because at Charlie Health, they're getting 9 hours of clinical programming a week. So 3 days a week, 3 hours a day, they're in groups. And then on the other days, they're in individuals or family sessions, or if they have a current outside provider, we're working with that outside provider, and that outside provider can continue to see them on an outpatient basis. Insurance will authorize both levels of care when it comes to Charlie Health, so that way they can stay with any clinician that they're connected to, or if the clinician wants to get them off their caseload and feels as though we would be the most appropriate care, they can make that referral.
Yeah, and I think that it's important to add to 6 to 12 weeks is the time span that they would be with us. Charlie Health, let me type it in here, charliehealth.com. So 6 to 12 weeks, and we start discharge planning on day 1 of treatment. So it's important for us to understand other clinicians, therapists, what their caseload is, so we can, you know, have that continuum of care the whole way through.
And just to clarify around the name Charlie, Charlie was the best friend of one of our co-founders who sadly died of mental health issues. And we really believe that because of the fact that he was going from outpatient to inpatient to outpatient, not having a proper step down continuum of care, that if he had something like this that was easily accessible, was in the safety of his own home, that he could experience every day, and be able to have peers that are similar to him in the struggles that he was going through, that his life would not have tragically ended. So it's just a reminder for us every day of why we're doing this.
Yep. Does anybody have any questions, clarifying questions about Charlie Health, maybe specific to our programming?
So this is a tele-based intensive outpatient treatment then?
Correct. And it will continue to be tele like forever.
Where are you guys at? Are you in Montana or?
Yeah, so we have a physical office in Bozeman. We're only in Montana, treating Montanans. All of our clinicians are Montanan based, licensed, master's level clinicians. So we have deep roots here, and know that Montana kids and young adults are really struggling and suffering. And the reason we chose to go virtual is because everybody in the state can access us.
So how do you, I'm just trying to think of how do you present this? What does it look like? Are you all on Zoom for 3 hours? Are you, what is this like?
Yeah, no, great question. So I can jump in here. I was lucky enough to be able to run several virtual programs, both partial hospitalization as well as IOP, and kind of know what it's like to try and engage teenagers and young adults in Zoom sessions, which can be challenging at times. So essentially what we do is we provide groups that are after school, so 4 to 7. And so what happens is 4 to 5 is typically a process group where they're sort of checking in, getting through their emotions, talking about their day, talking vulnerably. And then that 5 to 6 is more of a yoga, mindfulness, some type of an experiential group, maybe art therapy or music therapy to kind of break up those 3 hours. And then the third hour is typically something like a psychoeducation, emotional awareness, something that's a little bit more structured, but more therapeutically based. So that is essentially at 4 to 7, 3 days a week. Usually it's Monday, Wednesday, Friday, just to try and split up that week. And it's a way for them to get on and to connect with peers. So it's all group work, and we actually make our groups specific to the issues that the clients are presenting with. So we have a group right now that's specific, 13 to 15-year-old girls that are highly anxious, that struggle with school refusal. And then we have another group right now that's, your 17 to 18-year-old boys that are struggling with vaping and, experimenting with marijuana. Sorry, I'm just noticing this track.
Thank you. Thanks. That's helpful.
Thanks so much, Dr. Fenkel and Laura. I put information about Awareness Network in the chat. Jess and I can also make some introductions for you all over there if you want to chat with the folks leading them.
Yeah.
Awareness Network, just so you all know, so they are on Connect. You can send referrals. They provide funding support for any families, for any children and youth who need help affording the costs of therapy. So they're a great resource to have. They take, so through Connect, they're going to take referrals from any provider, and then they'll just get back in touch with you saying, here you go, here's how we're going to send payment. They send the payment directly to providers. So they're an amazing organization.
Sure. And I just got a question. We treat ages 12 to 27. And they're broken up into adolescent and adult.
Awareness Network serves 0 to 25, but sometimes helps families, like if a parent is dealing with a mental health struggle, sometimes they assist them too.
Okay.
Do you accept Medicaid?
So we are working on that contract right now. We should have it in our inboxes within the next couple weeks. If we don't, we will find a way to work with the client until we have it. But it is in our immediate future.
Okay. All right. Thank you. And how would we have a parent connect with you?
It's such an easy process. I'm doing all the admissions, so I can put my contact information in the message, and maybe Julie could distribute it. A call, a text, and email is all we need. And then from there, we'll do a verification of benefits and admission screening. Once that's sorted, within 24 hours, we can get the kiddo into the group. There is no waiting. We know that kids need immediate help. So we have, as Dr. Caroline said, we have groups starting Mondays, Wednesdays, Fridays. So depending on what time of the week, they can get in the same week with us.
Okay.
And we're also going to get Charlie Health on Connect soon. So that'll be coming, and there'll be an email out to all the users when they're up and running on that system and ready to receive referrals that way.
I have another question. I'm on your website. So it says you do family therapy. So with that, because Head Start, we do 3, 4, and 5-year-olds. So, and there's some kids that are 12 in the family for sure, and the adults, but I'm thinking of a family right now that's going through a divorce, but the child is 4 and the parents, they're not 12, but the parents are over 25. With that, is that like what is your family criteria on this?
Yeah, so unfortunately, since we are treating the person whose insurance that we're going through is going to be the client that is between 12 and 27. So we need the primary client to be that. Right now, for example, I'm treating a family that The client is 15, she's in IOP, and I just started seeing her mom individually because her mom's thinking about getting divorced from her husband. And so I'm billing it as a family therapy session with the client there, but it's just me and the mom meeting, which is totally fine with insurances. But so we're happy to work with the whole family. There just needs to be a client that's between 12 to 27.
All right, so if the parent is below 27 and they are billable, you could work with the family.
Yeah, absolutely.
All right, thank you.
Great, thank you all. If there aren't more questions for Charlie Health, and they can always come back, I'll have Jess Hegstrom talk about the suicide prevention and mental health trainings that are provided through the county.
Thanks, Julie. So I'm the suicide prevention coordinator for Lewis and Clark Public Health, so I oversee the county. So I'd love to speak with you, Laura, and Dr. Fenkel when we're not online. So maybe we can follow up at another time, and I can kind of tell you about some things that we're doing that might be appealing. But in terms of training, so my program has a grant from the Substance Abuse Mental Health Services Administration to provide mental health awareness training for workforce as well as the general public. So workforce meaning medical and mental health providers, first responders, and then it's teachers and coaches and everyone. We're trying to create a network of support where anyone can catch if someone's struggling. So we offer a 2-hour program called QPR. It's very similar to CPR. I'm seeing nods, so it sounds like people are aware of it. Daniel's certainly taken it. And so it's similar to CPR. It's a first aid course. You don't have to be a doctor or a nurse or a therapist. You just have to be a human being who cares and has a few extra tools to recognize warning signs and ask the question. We do youth mental health first aid and mental health first aid. With youth mental health first aid, it's really focused on adolescents, ages 12 to 18, but it really bleeds over into age 25 because we know that youth aren't fully developed, their brains aren't fully developed to the age of 25, so they're still impulsive and affected by their peers and all that stuff. So, but the training is really important because 86% of parents nationally who lost a kiddo to suicide didn't realize they have depression, and mental health challenges in youth tend to express themselves in very similar ways. So we want to help parents decode. So for example, like if Dr. Fenkel and Laura had a family, like you were serving a young person in a family, we could get the parents some training to just be able to be more helpful, recognize warning signs, that sort of thing. But really anyone and everyone can take it. That particular program is 8 hours long, although we are in the process of learning the virtual and hybrid options so that we can do a better job of dealing with COVID. So there's the virtual and hybrid is 2 hours of self-paced training and then either 4 hours in person or 4 hours virtual. Always happy to set that up as long as we have 8 people who can participate as a minimum. Otherwise, it's not a great conversation, and also it's a lot of hours to put toward a couple of people. And then we also, what mental health first aid's focused on substance use disorders and mental health challenges for adults. And then we also provide the ASSIST training. It's applied suicide intervention skills training. It's 15 hours long. It's pretty intensive, but if anyone's interested, we're happy to get one set up. It just takes like a month to set it up. So let us know now. The grant goes till October of 2021. So if you want free training, now is the time. We're happy to provide. It's great for our numbers. It's great for our community. Please let us know. I'll put my email in the chat and my phone number. Hit me up. And then we're also doing a campaign called the Military Strong Challenge, which is about building military cultural awareness and competency within our community. As many of you know, Helena is, well, really our whole county, but especially Helena is very much a military town. We've got Fort Harrison, we've got the VA, you know, we've got a lot of different services. So we want to be more supportive to our service members, veterans, and their families. Also, they are a risk group for suicide. So that's pretty much the gist. If you want to learn more, go to lcsuicideprevention.org. So Lewis and Clark suicide prevention, and there's a whole bunch of information on our different trainings and programs and etc. So I will stop there. Any questions?
No questions. I'm just looking forward to connecting with you after this, Jess.
Thanks so much, everyone. The others I had on my list aren't here, so I'd like to just open it up for folks to be able to share about their programs for anyone who hasn't yet. And any other questions about other services, open networking and sharing time.
My name's Julie Prickmore. I'm with the Center for Mental Health. I'm not sure if we were on your list or not, but
oh yes, so sorry, I just didn't recognize your name. Go for it.
Okay. Well, you sent it. It was Jennifer Whitfield. I think it got confused there. So as far as the center, we have actual offices located in Great Falls, Helena, Whitehall, which is our newest venture, Havre, Conrad, and we serve a lot of those areas. So what we have available specific to, well, pretty much any of our locations, but we have an LAC available for some substance use work. We do telehealth through all of these things right now. We have peer support, we have targeted case management, outpatient therapy, family, any of those kind of generic services that you would expect in a mental health center. We do have access to psychiatrists, nurse practitioners, all prescribed medications. We are starting a MAT program. It is up and running newly. Our newest provider is Carly Hamilton, so that's exciting news. What else? We have group homes available. We have day treatment. We have adult foster care. Pretty much anything, again, that you would consider for a mental health center to have. We did just do a new website, so I encourage you guys to go out and check out our website. It's updated with our services, and our application for services is on there and everything like that. So, and that's center, the number 4, mh.org. So I was really brief, but I'm open for questions.
I have a question. If we were going to make a referral for a family, what's the best way to get them connected to Center for Mental Health in Helena?
You would just call the Helena office. There you could call to make the referral. They can go online and fill out the application. That'll go directly into the referral as well.
Center for Mental Health is also on Connect, so you can make the referral that way, and that will get into the intake folks.
Which, yes, perfect.
Yep. Yep, and the other ways. I have to encourage Connect, so yep. Thank you so much.
I can introduce myself real quick. My name's Harley Brown. I work at Montana Legal Services Association. I'm the Health Justice Project Coordinator. So basically my work is around outreach and education and building networks with service providers who are working with communities that might be facing civil legal issues. A lot of you all are in healthcare, and so a main goal of ours is to address social determinants of health issues. So there's a lot of research around how health is impacted by a person's environment and social status. And so one way we do that at MLSA is that we have medical legal partnerships with several federally qualified community health centers, and then also a hospital in Missoula, where we have an attorney on staff who works directly with patients who are referred by those clinics into addressing any issues that could impact their health, particularly issues around housing, income, employment, and then personal and family safety and legal status. And so my job is to also kind of build that out in other organizations and also just do general outreach so people know about legal aid. We are on Connect and you can refer through that. But I'm also just available to talk to your staff more about what services are available or what legal aid they might qualify for and how that can impact their health greatly. I'll plug some resources into the chat box, specifically montanalawhelp.org, which MLSA runs. It has a lot of resources for folks who are facing evictions or threatens for evictions by their landlords. And I think right now that's particularly helpful. I'll also plug NeighborWorks Montana, who's helping folks apply for that emergency housing assistance funding. We're doing direct referrals with them. So if they get somebody who has legal issues around getting that funding from their landlord, they're referring clients directly to MLSA. Little about MLSA. We're just a nonprofit law firm in Montana. We're the only legal aid provider in Montana. So if you want more info, I'll put my contact info in the box there.
Thanks, Harley. I think we have visiting angels here, and they're also new to town, so I want to give them a chance to introduce themselves.
Thank you, Julie. Hi, my name is Judy David. I am the owner of Visiting Angels here in Helena. This is a nationally, or now they're internationally recognized franchise. So I bought the Helena Valley territory, which also includes Great Falls and Butte. Right now we're focused on the Helena Valley. We provide in-home care for seniors, disabled, and veterans. We believe that people are safer at home. We've definitely seen that, with the rise of COVID through facilities. We're also seeing the strain on families where they can't visit mom or dad, or they're waving through a window. We know that a lot of our elders are challenged to talk on the phone, and it's not the same as a hug. So we just want to support the community here and the network of providers to keep everyone safe. We do medication reminders, but we are non-medical. We're really big on fall prevention, exercise routine, just improving the overall quality of life and reducing stress for the caregivers. A lot of times the family caregivers have more stress. They're trying to do it all, and that's natural, but we're just here to support the patient, the family, and the community here. So if anybody has any questions, I'd be happy to answer, and I'll share my contact information.
Visiting Angels will be on Connect soon. Let's see, I think we also have, looks like we have Amy, and we have Intermountain, and we have Head Start, and Dan Beeland, and Childcare Connections. If any of you want to tell us a little about what's happening with your organizations and programs, you'd be most welcome.
Hi there, my name is Sarah Peterson. I'm at Childcare Connections. I'm the new family engagement coordinator. Some of you might have known Amber Kreis. I have taken on her role. So just a little quick introduction for those of you that might not know. Childcare Connections is a resource and referral agency. We serve 6 counties, including Lewis and Clark, Broadwater, Jefferson, Marr, Gallatin, and Park counties. And we administer the Best Beginning Scholarship for the state. So scholarship for those low-income families that need help with childcare. And we also work with providers to make sure that they're providing quality care, as well as a few other programs, including nutrition, and just resource and referral options. If you have any questions, feel free to contact me. I will put my information in the chat box, or I'm happy to answer any questions now that you might have.
Well, here at Head Start, we still have some openings for our remote learning option with family supports. So we are supporting, we have 10 children in our classrooms so those are all full. However, we still have the others opening, so any referrals would be welcome, and it would be pretty immediate support. And we actually have a remote specialist teacher, so the families will be given one-on-one support and different packets as this is going through, and then still have all of the supports that are offered through our family services department and family engagement efforts as well. So we would definitely love to see some more children and families coming in our direction. And that is true for Whitehall, Boulder, and Townsend, East Helena, and Helena. So we are on the connect. Send us the referrals, please.
I'm Daniel Velan. I'm here representing both. I'm a pastor of two churches, East Helena and Townsend. East Helena, we do have a small fund to kind of help people out who need gas money, things like that. Also, primarily, I'm with the Townsend Ministerial Association. We have what I've decided to call the Good Samaritan Fund, because it seemed like the least stigmatizing option. And we basically help out with anything and everything. The only thing we don't help out with is usually groceries, because there's a food pantry here in Townsend. But pretty much everything else we provide cash assistance, along with a couple other organizations in town. So yeah, if you have anybody who's in Broadwater County, you can send them our way. We also do, we're I think basically the only provider of emergency housing in town. There are a couple places that folks can get a little bit of help with a motel, but we work with the sheriff's office where folks can go there if they're passing through town, if they've just been released from the county detention facility, if maybe there's a couple and they need a cooling off period, the sheriff's office will call us and we'll approve a voucher for a night at the local hotel and potentially hot food if that's what they need. They can get a hot meal at the local Mint Cafe. I think that's pretty much my spiel. I do have a question that I've encountered talking to somebody. Obviously, I can sit down with folks and talk to them about kind of the Connect system and kind of move them through. But I was wondering if there's anyone else who might I'm not as familiar with, I'm getting familiar with all of the resources, but I'm not as familiar with them as other people might be. So if there's like somebody out of the blue who's like, hey, I know somebody who's looking for help and they've got all of these different needs. Is there somebody, I'm like, I can sit down with them. I might not be the very best person for that though. There's recommendations, or if someone just says, hey, I've got a friend who wants to talk to somebody, is there recommendations for other places that might be more informed about, kind of all the different resources in town?
Daniel, that's a really good question. So I'm always happy to consult with providers. My role is not to be the middle person. So I am happy to chat with you all, but I don't give out my number as I'm the hub of people to call for resources. Not necessarily, depending on what kind of like sector of resources they're looking for. Like United Way knows a lot about housing, so there's Good Samaritan here in Helena. Some of like I know a bunch of the agencies that work with us with early childhood can help out with those kinds of things. So not as of yet. I wish we had something like that. That's come up before in conversation, but right now, no. But feel free to shoot me an email and I can try to direct you to someone else if that's the best option.
Sounds good. And I mean, it sounds like I'm going to probably be the best person to talk to this specific person because they're kind of resistant to going and talking to folks, but their friend is convinced them I might be able to be someone they can approach. But it's just good to know whether there's somebody else out there who knows has the big picture view. Yeah. Thanks.
So there is 211, and anyone can call 211 or go on the website. They are staffed by Voices of Hope in Great Falls, so they are trained counselors. That's also our suicide where suicide prevention hotline routes to, I'm pretty sure. But you're also, but if you need someone to be able to like weigh the options of Helena, they may not be able to, like, they're great and they may not know the nuances that some of us in town will because they're not here. So, but hopefully down the road, we're going to be keep working with 211 to be able to provide more of that kind of support of walk through the different options and maybe even make connect referrals. Amy, do you want, oh,
I was gonna say, I just threw, the state judicial branch puts county resource guides together every few years. Those are done by AmeriCorps volunteers from Montana Legal Services. I wouldn't say that they'll be comprehensive, but it could be a place to start. So it's usually just one of our AmeriCorps at each of the courthouses in that community get assigned, like, 5 or 6 counties to follow up with resources every few years and see if they still exist. They're not going to be comprehensive, but.
I just pulled it up. This thing is fabulous.
Thank you. I did one in 2015, so it doesn't exist anymore, but it is a place to start if you don't know about a community.
all right, who are we missing? Amy, did you want to talk a little about your services?
Hi. Can you guys hear me?
Yeah,
I'm
you're
Amy
good.
Trainham-Farragut. Newly, I'm in a private practice in Helena. I've worked at several different agencies over the years, but now I'm in private practice here in Helena. And I'm just glad to meet everybody and hear about the different services. I am so busy. It's gone really well. So. Yeah, nice to meet everybody.
Great, thanks, Amy.
Happy Friday.
I am Kim Sickerson. I am a case manager with Intermountain. And if you're not familiar with Intermountain, we're an accredited mental health center here in Helena. And we provide a variety of mental health services, primarily for children. Although there are a few things that delve into servicing adults, such as medication management, but I believe that only goes up to age, I can't remember if it's 26 or 27. And then some of our therapists do family therapy as well, or I should take that back. They do some individual therapy with adults as well. But we provide not only case management services, but of course therapy services, individual and family, and occupational therapy, medication management. We have 2 providers on staff. We do CSCT services in the schools. I think we're in almost all of the schools in Helena except for a couple of them. So we have that. And a lot of people don't know that we have a residential facility here in town too, that can service, right, we used to service up to 32 children, but we cut that back with COVID. So now I think we're servicing 28, I think, kids on campus. Let's see, what else? I think that's most of it. So if anybody has any questions, you can let me know, but we're always taking referrals, of course.
Awesome, thanks, Kim.
Mm-hmm.
Am I missing anyone else? Other agencies? I also want to ask you all, who do you want to hear what kind of services or who do you want to hear from in October? What would be helpful for you in your work to know about who's around providing what? Feel free to drop me an email also. Happy to kind of structure these as they'll be most beneficial for you all on the ground providing services. If there's any other questions or comments, feel free to stick around and we can chat. Otherwise, thank you all so much for being here. Happy Friday. Happy autumn.
Thank you.
You too. Thanks.